So I've got my triple tray, and the first thing that I want to make sure too is the fact that I know exactly where I'm going to be taking my impressions, and we're always going to line up the back of that triple tray and try it in. Don't just assume the patient's going to know exactly where to bite down on, because some patients will bite and they'll actually hit the plastic, right? So if they're hitting the plastic, you know that those teeth are not going to be engaged all the way and the patient's not going to be able to bite down. Hence the purpose for the mesh. And so I'm always going to kind of give the patient an idea of exactly what we're going to be doing today. We're going to be taking an impression before we start the procedure, and I want to just kind of seat this and tell you a little bit about how this is going to feel and make sure that you can bite down all the way. So I'll place it in the patient's mouth, and I'm going to ask Mary to close for me and make sure that I have a really firm grip on that, okay? So that is always important, and making sure that they're not hitting that plastic. Now what I'm going to do is I'm always going to utilize a timer, because in dentistry everything is slow. The beauty of the Vipicil is the fact that we can have a really fast setting time and a working time, so I still want to have a timer. So what I'm going to do is I'm going to go ahead and just start extruding some of the material out, okay? And I'm always going to start the furthest away, and I want to make sure that I have enough material and I'm not lifting my tip. You can see that I'm going to make sure that nothing is lifted until I get to the very end of that mesh, okay? Now what I'm going to do is flip it over, and I'm going to start again. And I got to move pretty quickly, because remember, this is a fast setting material, okay? And I'm going to sit that down, all right, making sure I've got enough product on both sides. I'm going to take the tray and I'm going to insert it in the patient's mouth, just like that. And I'm going to ask Mary to close down on it all the way till those teeth are engaged.